I'm George Russell, and you probably knew that already, but it's always nice to reiterate it. So I'm going to talk a little bit about the shoulder in this video, and always be suspicious of someone who says that there are many symptoms but only one cause. But I'm still going to argue for that. So I'm an unreliable narrator today. So a lot of different shoulder problems, from rotator cuff tears, acromial impingement, even to some extent frozen shoulder, can be caused by a malposition? Yeah, I guess it is a malposition of the upper arm bone in the socket with the shoulder blade. So that's a very shallow ball and socket joint, and it's supposed to, when you roll one direction, like I have to roll this way in the ball and socket to go up, but I have to glide equal and opposite direction, because if I don't, the cartilage doesn't stay close to the cartilage. So I'll show that on a mortar and pestle if I can find one. Don't I have a mortar and pestle around here? I don't have an egg beater, but I have a mortar and pestle. So when I lift my arm like this, it's like this is happening. When the big muscles work, this is what happens. But it has to glide equal and opposite. Otherwise, these cartilage surfaces are not going to be next to each other, and the body hates that. It causes a lot of pain and problems. Now, the part of the body that does that is the rotator cuff. Let's go over and look at one, sort of. This is Eleanor. Say hi. So the whole shoulder blade is wrapped in meat that comes right out of the bone, up here, here, even on the front surface. All those, here's that shoulder joint. All of those fibers converge right out here, like an epaulet. And that's why it's called a rotator cuff, because there's a little cuff right here. These muscles are very close to the bone, and even though they do rotate, which is a gliding motion, their job is to suck the humeral head into the socket no matter where you take your arm. So acromial impingement and supraspinatus fraying and tearing and so on. The supraspinatus comes through here, and the acromion is here. If this goes up, which is what the deltoids do, and it doesn't glide back down, then you get a squeezing here, and that's also a squeezing of the tendon here, and that's those injuries. So you want to always glide down in the socket rather than just rolling up. The big muscles do the rolling, the rotator cuff does the gliding. So the rotator cuff is always involved in these syndromes, okay? Now, the shoulder, almost without exception, the upper arm bone glides this way in the joint. So it goes up and it goes forward. And this happens particularly on flexible people who might stand like this and gravity carries their shoulders down, or even like this and gravity's carrying their shoulders forward. It happens a lot in flexible people. So squaring your shoulders isn't such a bad thing, and I'll show you a version of that. But as long as you don't square your shoulders by sticking your ribs forward, it really has to be moving your arms back in the socket by rotating them, that which will pull them back, okay? So we're going to look a little bit at how that can be done. So if you can come help me show this from the side. Here's a thing you can do to help. So the shoulder bone often is going this way. It's up here in the socket. I'm grossly exaggerating, rather than here. So I'm going to take my arms against the wall, take my feet back a certain amount. Now, the farther back you are, the harder the work is, because you're supporting more weight on your shoulder. Now this will need a close-up. I'm going to turn the soft part of my elbow towards the ceiling, and that will turn out my shoulder. Remember I said turn out at the shoulder helps to put the bone further back. The next thing I'm going to do is press my fingers, the medial fingers, these inside fingers, make sure they're pressed on the wall, because usually when you turn your shoulder out, this happens. But you want to turn just your arms out. Now, this is probably the trickiest part of this exercise. You're going to let your shoulder blades fall together so that your rib cage goes forward, so that your collarbones go forward. Here's the two ways, or the major ways, where you might go wrong. One would be to substitute your spine, and that looks like this. The other one is to bend your elbows, and that's not going to help you, because you want the solid arm with the weight of the wall. You want to use the weight of the wall to push your shoulders back a little bit. So you're going to, that's from the back. So you're going to let your shoulder blades fall together, which means your upper spine will go forward. And then you want to move them as far apart as you can, pressing into the thumb and forefinger and keeping that soft part of the elbow facing up. I like to call these spine ups, because it's not a push-up, because your elbows are not bending. So that's a preliminary way. Once you've got a little bit of strength in your shoulder, you can show this from that side. I want to still keep the elbow facing up. I want to still keep the thumb and forefinger on the wall. But now I'm going to take the other arm off the wall and just let it hang. So now I'm having even more force going through the shoulder. And if something like this happens, then that's very sad and you don't want to do it anymore. But remember, exercise is meant to fail. If you're not coming to a point of failure, you're doing an exercise you don't need. So as I turn, this is much more advanced, I want to keep this back. I don't want this to happen. I want to keep this like this. And the way I do it is by rotating, that's the soft part of the elbow up, and by keeping my thumb and forefinger on the wall and my arm nice and straight. So that's going to help move this back. One more exercise you can do. Find a chair with arms. Once you've done that, sit in the chair, and here's what you're going to do. You're going to turn your arm out all the way. So now my palm is facing up. My thumb may even point down. I have flexible shoulders, so results may vary. So now I'm going to try to bring my arms back to touch the chair. If your arms aren't as flexible, you're going to be very far back in the chair. And then I find the chair with my arms. Keeping my arms straight and my shoulders turned out as much as I can, I'm going to press a little bit into the chair. Why am I doing that? It's similar to what I did on the wall. So first, I'm spinning the shoulder out, which brings it back in the joint. But then, I want to see if I can bring my collarbones forward. And that's the same thing as pressing my arms into the chair, but it looks a little different. So here, I'm pressing my arms into the chair, and that brings my humeral head to the top of the upper arm bone back. But here, I'm doing that, and I'm trying to also bring my collarbones forward. It's the same action, but with a slightly different orientation. And that will lead to you having a nice open chest, which is good for so many things. So give those a try if you have a shoulder problem, and definitely let me know if they work or if you have a question.